Hello, my name is Stefan Vojnovic, and my fellow group members Marla Irish and Ashley Flanagan will be presenting artificial intelligence, or more commonly known as AI in healthcare. It is a constantly growing technology and has been seeing more and more use in the field of medicine. It has grown so greatly that some predict that AI could replace doctors in many of their duties, due to the growing precision and accuracy of AI technology. We will mainly focus on how AI has assisted in diagnosing patients, helped manage personal health care for many people, and aided hospitals and doctors to be more efficient and effective in treating patients. First, I will start us off with AI in aiding a diagnosis for patients. AI is truly wonderful because of how adaptive it can be in situations and that it can be taught to understand more about humans. It can be molded to specialize in taking care of certain patients, and it can be molded to be able to give individualistic prognoses and diagnoses. For example, the first image shows how man can be scanned and can be diagnosed by AI quickly and efficiently without the aid of a doctor. According to a 2017 research article titled Artificial Intelligence in Healthcare, Past, Present, and Future, AI is mimicking human thought more rapidly with high-end analytical technology. It is able to evaluate cancer, neurology, and cardiology accurately for a diagnosis and prognosis in patients with diseases, or with more advances each day, AI could eventually become a tool that could give an accurate diagnosis for patients without even needing a doctor. The second image represents that in the future, AI could diagnose any area of the body from kidneys to heart to lungs to spine to hearing. According to another 2017 research article titled Artificial Intelligence in Medicine, Electronic Health Records actively help the AI in guiding doctors with a diagnosis and prognosis for patients. The current stored health records will continue to build up and will be able to help in treating patients accurately and efficiently in the future. The AI could see links in a patient's past with others of a similar type of history and determine even rare disease and necessary treatments the patients may need. For example, someone with leukemia or other such serious disease can be seen and compared with their history of leukemia and others who have gone through the same treatments and what treatment may be better. Now that you have an understanding of how AI can help with prognosis and diagnosing a patient, Marlo will speak about AI in personal healthcare.
Everyone is different, and therefore each person requires different, individualized health plans. Using AI can allow physicians to provide better quality healthcare for patients. AI will have programming from previous studies and statistics. As new patients enter the system and new symptoms are logged, there is a wider spectrum for the system to pull from. As stated in our article on digital medicine, clinicians and public health practitioners can use the technology to deliver tailored therapy or interventions based on the best evidence to maintain high-quality patient care and create healthier communities. It can also be used for people to keep track of managing their diseases or chronic illnesses. Those with diabetes may need to keep track of their blood sugar levels and know when they need insulin. AI can also be incredibly helpful when it comes to the elderly. Elderly people with dementia may not be able to remember what medications they need to take or when. An AI system programmed for them can remind them at what time of the day this medication needs to be taken. This also allows for older people to live independently if they don't have anyone to take care of them or if they just want to live alone. Now I will be speaking about AI in underdeveloped areas. AI could allow for underdeveloped countries or locations of low income to have more access to healthcare. Mobile phones have become much more readily available in disadvantaged areas, which means that AI could be applied in these settings. Although there hasn't been much research done yet, there are endless ways for AI to be used to help people in these places. One example is AI can track locations and people in order to trace where certain diseases are more prevalent. Systems have access to electronic health records and other outlets in order to track the spread of disease and how fast it's traveling. Since there can be a significant lack of access to primary care physicians, AI can be applied to poorer areas and act in place of a physician if one is not there. This could significantly help people in the long run to avoid unnecessary trips to the ER and help prevent them from getting more diseases.
Artificial intelligence has had great success in recent years in a clinical setting, with more hospitals and doctors looking to incorporate this technology into their pre-existing systems. The deep learning technology utilized by AI allows the programming to gradually get smarter every time it's presented with new information. This means that over time, artificial intelligence will be able to provide unprecedented levels of accuracy and efficiency in hospitals and by physicians. The usage of artificial intelligence also brings with it a new realm of professions, as doctors are working hand in hand interpreting the results presented through AI. This technology can take the place of doctors like radiologists and pathologists in studying images and do it with more accuracy. thus allowing doctors to free up their time to focus on treatment methods rather than diagnosing patients. The speed and efficiency of artificial intelligence could also mean less time spent in the hospital for patients, thus reducing the costs associated with healthcare. It is apparent that there is a vast amount of potential for the use of artificial intelligence when working collaboratively in hospitals and with doctors in the future. Finally, before we end this presentation, we would like to provide you with some food for thought about what you have just learned. If it was up to you, what would you focus on changing about artificial intelligence in order to improve healthcare costs? Do you believe AI is a technology that is here to stay, or will it soon be overrun with a new up-and-coming technology? And lastly, in what other ways do you see artificial intelligence being incorporated in a healthcare setting, or more broadly in public health, other than what was already mentioned? The last thing we would like to do is to briefly showcase our image and information references that you can look into if you have any more interest or questions about the future of AI in medicine or in healthcare. Thank you.